in the transition from being inside mom to being out in the big world. As you can imagine, there's a huge amount that our babies' bodies need to do to kind of change from not breathing and getting all of our blood and oxygen from mom to being able to do all of that on our own. It's quite surprising that so many babies actually transition so well. So first thing that we often do is we'll stimulate the baby. We'll take towels and we'll rub down the baby. Sometimes we'll kind of flick their hands or their feet to kind of get them to kind of take a big breath in and start breathing on their own. If that doesn't work, sometimes because babies have a lot of fluid in their lungs, we need to help push that fluid out of their lungs. So we'll take an oxygen mask. So we'll take a mask and we'll just place it on baby's face without this plastic, but I don't want to get this mask dirty. And we'll just give them regular air with a little bit more pressure. Now, we're not doing very much for baby, we're just helping to support breathing. Sometimes we have to help breathe for them, and if that's the case, we'll do that with the same mask, and we'll just give them a little bit of pressure. We'll make sure their airways are nice and open, we'll be watching their chest to make sure it's rising and falling, and we'll be keeping a close eye on their heart rate. Sometimes there'll be a nurse also helping us to listen to their heart rate and to do some monitoring. Now, we're right in the path of vision for mom, so mom and dad can watch us as we're doing this, and we're only 3 feet away from them at this time. That solves the vast majority of babies' problems, and they usually start breathing on their own and transitioning well at that point. It's very rare that we need to do anything more than just helping them to support them breathing.